I'm Dr. Annette BoVee-Akyurek. I'm both a psychotherapist and also a physical therapist. I have an integrative psychotherapy practice. I look at the whole of the mind, the body, and also how is somebody's environment affecting how they feel, how they function, and how they're moving through their world, both within their body and also within their relationships around them. I don't work very much from a diagnostic base. I'd rather look at what is it that somebody's feeling, what is it that you're thinking, how are you interacting with your world. And I'm also not big on right, wrong, good, bad, or shoulds. So I work very collaboratively with the client. And what that means is we work together. We move forward, and I'm more like a facilitator in your process. I incorporate a lot of different modalities. It's very unique for each individual. I don't do the same thing with everyone. So one of the modalities that I do is craniosacral therapy, and there's a big somatic part to that. So what that means is craniosacral therapy is a osteopathic approach. So yes, we are working with various areas of the physical body. It works all aspects of the physical body, but it also has a somatic component. And what that means is we tap into, through the body, what is it that somebody may be holding? What information can we get from a subconscious level? And that could be very powerful, not just for the psychotherapy client, but also for someone that comes with chronic physical conditions. Another modality that I utilize a lot in my practice is EMDR. So that stands for eye movement desensitization reprocessing. So EMDR can be super powerful when we want to change something that's become a theme for us, a theme where it's getting in our way, something that we do all the time. So first we look for a theme, and then we look at what is it? What are some things, earlier experiences that somebody has had that may have had impact to this theme that occurs in their life now? So this is also very deep work and can tap into the subconscious and allows the person to experience some of the feelings or the emotions or some of the environment of what occurred that they may have pushed down. And once they return to that a bit, it allows it to come forward and release a bit out of the body. And therefore they're able to, the theme actually shifts or changes. Another therapy process that I utilize is hypnotherapy. So hypnotherapy, again, all of these modalities has a similar quality, in which hypnotherapy has a level where we try to shift some automatic thoughts. We're again working from the subconscious and trying to change some things by putting somebody in a meditative, some people call it trance state, but it's more like a meditative state, and working with some issues that the person's experiencing in their life that comes forward in therapy, and then bringing that into a deeper level to try to shift the way they think about these things, how they process these things, and to where they can notice some changes later. I also incorporate a lot of centering activities, and what that means is activities to help us come and feel and tune into your center. Also some grounding activities. Grounding is more than just walking barefoot in the grass. It's I like to do it in a meditation process where you're doing some breathing and allowing the breath to move through the body, out through the feet and into the earth, which can be very centering, very connecting to self. And then I also utilize a lot of talking about being present. Being present is a huge part of moving through your process, and also doing breathing meditations. I'm big on that. I believe that a breathing meditation for me is breathing in and out of your body, allowing yourself to feel that breath in and out of their body, and being able to tap into aspects that may be there that we need to see or perhaps shift. So I work with a variety of different diagnoses. I don't like to put labels on people, but to give you a little bit of understanding, anywhere from anxiety and trauma, minor levels of addiction, relationship issues, couples issues, families issues, sometimes career development, self-esteem issues, um, feelings of not being connected to self, sleep disorders, a variety of issues, anything to where somebody feels that they want to shift or change, or even sometimes even get to know themselves better. There's also a variety of physical issues that I continue to work with clients. For instance, there's a lot of chronic physical conditions that people experience that can have a huge impact from what's going on psychosocial emotionally. So for instance, TMJ issues, intestinal issues, low back pain, chronic fatigue, fibromyalgia, sometimes even a lot of holding or tightness in the chest region, any kind of chronic ongoing physical conditions. I think it's very wise to look at how is our psychosocial emotional parts of ourselves perhaps having impact to what our physical body is experiencing. That would also include headaches as well. So the ways of working with that is to, yes, the craniosacral somatic work can be very helpful, but sometimes it takes also exploring from a psychosocial emotional avenue, using sometimes some of the other modalities like the EMDR or the hypnotherapy, or really just sitting together and exploring and finding the components of what's influencing somebody from a place of curiosity. And remembering that we all have what we need for healing. We all are capable of having impact to shifting ourselves. And it's my position to help facilitate that power that you have within and helping you shift and move forward.